All right, good afternoon. It's 2:15, so we'll go ahead and get started, and people can filter in a little bit. My name is Jeff Swanson. I'm from Duke University, the Department of Psychiatry and Behavioral Sciences, and it is my privilege to serve as the introducer and the moderator for this session this afternoon on points of access interventions for at-risk individuals and the lethal means of violence. So we're going to talk about interpersonal violence, and we're going to talk about lethal means, and we're going to talk about interventions and maybe laws and policies to try to limit the access that people who are at risk might have. I have to say, listening to the presentations this morning, when I have the opportunity to be a part of a meeting like this, where we get a bunch of really smart people together to think about the problem of violent behavior and what to do about it, it's tempting to, as a thought experiment, to imagine that we had a blank slate and we could just do whatever made sense from a public health perspective. You know, if that's where we started, we might say to ourselves what some of our peer high-income countries say, which is the idea that everybody should be able to have a handgun for their personal protection is just too dangerous, and we're not going to allow that. If you don't have a better reason than that, we're going to broadly limit legal access to handguns as a very lethal means of violence. And we've actually tried that. Here in the District of Columbia, there was a time when handguns were limited, and there's research that suggests that saved lives. That's actually not the country we live in now. That was the law that was overturned and declared unconstitutional by the Heller Court in D.C. versus Heller. So we have to start in a different place and do something really difficult, which is to try to figure out who are people who should not have access to guns. And even people who disagree politically about things like gun control, do agree on the idea. And so does the Supreme Court agree on the idea that, for example, even though having a gun is a constitutionally protected right, it's not an unlimited right, but we have to figure out what the limits are without overriding someone's right illegitimately. So the problem is this is complicated because while epidemiologists and public health specialists talk about risk factors and disease states and legal professionals talk about statutes and laws and statutory criteria, when you go out into the real world to try to look at these phenomena and where the problems are happening and where we have to solve them, you don't see a risk factor walking around in isolation. You don't see a disease state in the abstract in some pure form walking around in isolation. You don't call a statutory criterion to go solve the problem. What you see is people. And people are really complicated. And violence is really complicated. And it's not caused by just one thing. There's not one master explanation for it. Mental illness as a cause of violence doesn't do that much work for us. So that's what we have to struggle with. And that's why, I think that it's a wonderful opportunity that we have today to look at these things and look at what the evidence is, what science can tell us about what we know about what kinds of laws, interventions, policies may work, what some of the potentially adverse consequences might be. So what we know, what we don't know, and maybe what we think we know that ain't so. So I'm very pleased that we have a distinguished panel to help us today with this. We have Dr. Andrew Engelmeyer from the University of California, San Francisco, and he's a specialist in epidemiology and biostatistics. And he is going to lead off the session by presenting his review paper, which is about this very matter, suicide and homicide as at the interface with firearms in particular, and legal access, limiting access to those interventions and what we know about that. And he's done a systematic review and a meta-analysis. He's going to take about 25 minutes and present his review paper to us. Following Andy's presentation, we're very privileged to have Professor David Hemingway from Harvard, who is a professor of health policy there, and he's going to present a response to Andy's paper and make some other framing remarks. He's a very distinguished fellow too, and I'd encourage you to take a look at the biographical descriptions of our panelists as well. And he's going to do that in about 15 minutes. And then following David's remarks, we will have Professor Shannon Frateroli, who's going to speak to us for 15 minutes about gun violence restraining orders in California, which is a new innovative legal tool that families can use and law enforcement officers can use to actually remove firearms from people who are at risk. And so they're all going to hew closely to our time limitations because in addition to being very, very accomplished people, they're also very considerate and compliant and humble folks as well. So we're going to do that. So thank you very much. With no further ado, I'll present to you Andy Engelmeyer.